Introduction to Trauma-Based Mind Control. Definition. Trauma-based mind control involves the deliberate use of psychological, physical, and emotional trauma to manipulate and control an individual's thoughts, behaviors, and beliefs. The goal is to break down the person's sense of self and impose new, desired patterns of thinking and behavior. Techniques often include isolation, repetitive messaging, manipulation of information, and infliction of trauma. By the end of this lecture, participants should have a foundational understanding of trauma-based mind control, its historical development, and the ethical issues surrounding its use. This knowledge will set the stage for deeper exploration and healing in the subsequent weeks of the course. Psychological manipulation. Methods. Gaslighting, making someone question their reality by repeatedly denying the truth, lying, or distorting facts. Example, a partner constantly tells their significant other that their memories of events are incorrect, making them doubt their sanity. Deception, providing false information or lying to control the narrative. Example, a cult leader lies about the outside world to keep members isolated and dependent. Coercion, forcing someone to act against their will through threats or pressure. Example, an employer threatens to fire an employee if they do not comply with unethical demands. Impact. Victims become confused about what is real and what is not, leading to dependency on the controller for truth. They may begin to doubt their own memories and judgments, making them more susceptible to further manipulation. Physical and emotional trauma. Methods. Physical pain, torture, abuse, or deprivation used to instill fear and compliance. Example, prisoners are tortured to extract confessions or control behavior. Emotional distress, verbal abuse, humiliation, or manipulation that erodes self-esteem and creates dependency. Example, a partner uses constant criticism to make the victim feel worthless and dependent on them. Impact. Trauma disrupts the individual's mental and emotional stability, making them more susceptible to manipulation. Victims may experience chronic stress, anxiety, and a diminished sense of self-worth, increasing reliance on the controller. Dissociation. Creating psychological fragmentation. Description. Dissociation involves creating a divide in the person's consciousness, making them more susceptible to control. This can happen through intense stress, trauma, or manipulation. Impact. The individual's ability to think critically and resist control is diminished. They may experience a sense of detachment from reality, making them more compliant and easier to manipulate. Example, a trauma victim may dissociate during abusive episodes, leading to a fragmented sense of self and increased vulnerability to control. Historical context. Ancient and medieval times. Early forms of mind control. Religious and cult practices, rituals, and fear were used to maintain control over followers. Example, religious leaders would use the fear of divine punishment to control behavior and maintain power. Impact. These early forms of control set the foundation for more sophisticated techniques developed later in history. Military and political use. Historical examples. Governments and military organizations. Various governments and military organizations have explored and implemented mind control techniques to influence populations and enemy combatants. Example, ancient empires would use propaganda and fear to control conquered populations. Impact. These methods were used to maintain power, control dissent, and manipulate public perception. Development of modern techniques. 20th century research and programs. MKUltra, 1953 to 1973. Description, a CIA program aimed at developing mind control techniques involving experiments with drugs, hypnosis, and psychological torture. Unethical practices, notorious for unethical practices and lack of informed consent from participants. Impact, many victims were subjected to severe trauma, leading to long-term psychological damage. Nazi human experimentation. Description, during World War II, Nazi doctors conducted inhumane experiments on prisoners, focusing on methods of control and manipulation. Impact, These experiments were a precursor to more structured mind control research, highlighting the extreme lengths to which governments would go to control individuals. Soviet Union and brainwashing. Description: the Soviet regime used psychological techniques to indoctrinate and control political dissidents and prisoners. Impact: these methods were used to suppress dissent and maintain control over the population. Key figures and events. Dr. Ewan Cameron. Involvement: a psychiatrist involved in MKUltra, known for his work on psychic driving and other experimental mind control techniques. Impact: his experiments left many patients with severe psychological damage, highlighting the dangers of unethical mind control research. Patty Hearst kidnapping, 1974. Event: the heiress was kidnapped by the Symbionese Liberation Army, SLA, and reportedly brainwashed into participating in their criminal activities. Impact: her case illustrates the potential for mind control techniques to alter behavior and loyalty under extreme circumstances. Ethical considerations and human rights. Ethical violations. Description: many mind control programs have been criticized for violating ethical standards and human rights, including lack of consent and infliction of harm. Impact: these violations have led to long-term psychological and physical damage for many victims. Current perspectives. Description: modern psychology and psychiatry emphasize the importance of ethical treatment and the protection of individuals from psychological manipulation and trauma. Impact: there is a growing recognition of the need for ethical guidelines and oversight to prevent the abuse of psychological techniques. Conclusion. Summary of key points from the lecture. Awareness. Understanding trauma-based mind control is crucial for recognizing and protecting against psychological manipulation. Awareness allows individuals to identify the signs and symptoms of mind control, empowering them to seek help and take steps to break free from such influence. Ethical considerations. The use of mind control techniques often involves severe ethical violations, such as lack of consent, infliction of harm, and manipulation. Modern psychology and psychiatry stress the importance of ethical treatment and the protection of individuals from psychological manipulation and trauma. Ethical guidelines and oversight are essential to prevent the abuse of psychological techniques. Summary. This lecture provided a comprehensive overview of trauma-based mind control, including its definition, key concepts, historical context, development of modern techniques, and ethical considerations. Participants should now have a foundational understanding of how trauma-based mind control operates and its profound impact on individuals. This knowledge will be crucial as we delve deeper into specific aspects and healing strategies in the subsequent weeks.